Hello, and welcome to AFSPA Live, our monthly digital broadcast designed to give AFSPA members and eligible federal employees a place to ask questions and get answers about past AFSPA Talks topics, their benefits, and wellness needs. There are 3 primary ways you can join our broadcast. Join us live by clicking the link in this video description and following the instructions to allow access to your camera and microphone. Then, a show moderator will be available to assist you further. You can ask your question through the chat box on whichever social media platform you're streaming AFSPA Live, YouTube, Facebook, or LinkedIn. If you're not able to join us live, call our toll-free line prior to the broadcast at 888-435-0757 and leave our team a voice message that we may play back and answer live on air. Just tell us who you are and the question you'd like us to answer. I'll see you at the next AFSPA Live.
Hi, everyone, and welcome to AFSPA Live. AFSPA Live is a live video broadcast Q&A session that we stream every last Thursday at 11 a.m. Eastern Time. My name is Maddie Norton, and I'm excited to be moderating the show today. I'm a junior coordinator, communication coordinator at AFSPA, and today we will be talking about breast cancer awareness, prevention tips, and cancer care management programs with our host, AFSPA's COO, Kyle Longton, and a special guest from Pinnacle Care. And Kyle, if you're ready, let's go ahead and jump into today's discussion.
Absolutely. Thank you so much, Maddie. And I am excited to introduce our special guest. Melissa Wolf is an assistant medical director with Pinnacle Care. Listeners of our podcast, AFSPA Talks, will recognize her name and soon recognize her voice. She did a fantastic episode for us, just giving us basics of breast cancer, treatment options, and so forth. So I encourage you, if you haven't listened to that, please go back, add that to your listening coming up. I should mention that Melissa is a certified oncology nurse practitioner, and she has more than 25 years of nursing experience, with the last 15 working as a nurse practitioner in hospice, palliative care, and oncology. She's been an assistant medical director at Pinnacle Care for right at a year. Happy anniversary coming up, Melissa.
Thank you.
So thanks for being with us.
Sure. Thanks, Kyle and Maddie, for joining me, for inviting me to join you all with this very important discussion about breast cancer. We know October is Breast Cancer Awareness Month, so certainly a great time to just talk about some of the basics, answer any questions that folks have, and hopefully, most importantly, also talk about how Pinnacle Care can be a service and a support to your members if they should be impacted by this disease. So thank you.
Absolutely. So Maddie, if you're ready, we've got the purpose, as you said, is sort of for our members to ask questions and to get them expert information. So do you have any questions?
We do have some questions today. It looks like our first one is from Cam Ting Wong, and they have asked, how often do you suggest getting a mammogram, and what age should one start getting those?
Great. So a great place to start is screening and breast cancer prevention. So mammograms are the gold standard for routine breast cancer screening for women. And there's been a little bit of a variation in terms of standard recommendations over the past year. So I think that maybe sometimes leads to a little bit of confusion for folks. But the standard is any woman over the age of 40 is eligible and should consider having an annual mammogram. By the age of 45, the American Cancer Society recommends that as a standard starting point. So that between 40 and 45, it's a discussion between you and your physician, looking at family history, risk factors, etc. But definitely by the age of 45, we really do recommend annual mammograms. And then the United States Preventative Services Task Force, so the USPSTF, recommends by the age 50 that women do have annual screening mammograms. And then once you have started on that process, screening mammograms should continue as long as a person is thought to have at least a 10-year life expectancy. So these days, people are living longer, healthier, into their 80s, still getting screening mammograms. So again, front end, when do you start? Back end, when do you stop? That's an individual discussion that should be had with your providing physicians. But standard being to strongly consider starting annual mammograms by the age of 40, and definitely by the age of 50, you should be having annual mammograms, definitely. And then there's also other discussions. There's other groups of folks. So women who are considered high risk, so strong family history, women who may have certain genetic mutations. So if you know that you or in your family, there's something like a BRCA mutation that we talk about, those put people at even higher risk for breast cancer. And they fall into an entirely separate category for high risk breast cancer screening, where mammograms might start earlier, and screening may also include MRIs. So those are kind of outlying categories, but standard, somewhere around the age of 40, you should be starting annual mammograms.
Right. And I just want to jump in and remind our members that routine mammograms are covered at 100%. We want you to get those screenings. And we found, particularly over the last 2 to 3 years, some of us have fallen off on our routine screening. So get back in the habit of it. They are covered. Routine are covered at 100%. Now, if we talk about non-routine mammograms, for diagnostic purposes, even sometimes getting into, as Melissa mentioned, the MRIs that may be done for diagnostic purposes, those are going to be considered, under a different benefit, but they're in network or overseas are covered at 90%. So I encourage you, please do that. Even if you're overseas, check our website. We've got some fantastic partners around the world. I've met with some of them this week who are dedicated to preventive care, who are focused on helping you get those screenings. So please don't let anything prevent you from getting preventive care.
And Kyle, that brings up two other terminology points that I was just thinking. The terms of a screening mammogram versus a diagnostic mammogram. People should know that really it's the same test. The difference is that a screening mammogram is done without the radiologist present in the room. A diagnostic is being read real time. So really the only difference between those two mammograms, the test itself, is that you're getting kind of results sooner. And so women who may have had a history of breast cancer, sometimes the first couple of years they'll do the diagnostic, but as you move away from the time of the breast cancer diagnosis, so say you're 5 years out, insurance might say, no, you need to go back to screening mammograms. It's not a different test. It's not a less useful test. It's the same diagnostic test. I shouldn't use the word diagnostic. It's the same mammogram. So you're not getting a lesser product. It's just that you're not getting the results at the same time. So don't get so hung up on that. If insurance says you have to have screening mammogram is very, very valuable. And then the other question is technique. In the recent years, 3D mammograms have come into favor. This is something that is generally covered by your insurance as well. It is a preferred type of mammogram, so 3D versus what was before just the 2D, two-dimensional. They are able to better visualize the breast tissue with the 3D mammogram, especially for women who have a history of having dense breast tissue. This is a more precise screening tool, so that is something that should be requested as well.
It looks like we have 2 questions from YouTube. People are interested to know more. So our first question is from Anne, and she is asking, what exactly does radiation do, and why is it important with hormone-based cancer?
So radiation itself will kill cancer cells. It also, in the process, will kill healthy normal cells as well, so you can have the effects of the radiation too. But the purpose of radiation, if we take a step back, so a woman's had a diagnosis of breast cancer, and typically they'll have surgery. Depending on the situation, they may or may not be offered chemotherapy. But many times after a woman has had a tumor removed from the breast, radiation is offered just to ensure that there is no disease left at the cellular level. Pathology at the time of the surgery is looking at the tissue and making sure that you have clear margins, but cancer is one of those things that a cell can kind of get on its way, and it isn't detectable. So radiation provides the best chance to make sure that we have completely eradicated any cancer cells, and lowers the risk of breast cancer recurrence. So radiation itself alters that cell so that the cell dies. And again, sometimes you will have residual or surrounding tissues that are impacted by that as well. And that manifests in kind of that, the redness that you could see. It's almost like a sunburn in the surrounding tissue. But very effective at making sure, at reducing the risk of breast cancer recurrence in terms of a cancer treatment.
It looks like we have another question from you too. And Christine is asking, is there any type of food or diet that is suggested for prevention of breast cancer?
So that's a great question. Really, I guess at the end of the day, generally, no. However, we do know that a healthy, varied diet, high fiber, kind of low fat, I guess we say everything in moderation kind of diet is really the best way to go. Having said that, some things that can increase your risk for breast cancer is being overweight, and that's actually specifically in women who are postmenopausal. So there's actually some studies that say, that show that women who are premenopausal and overweight actually has a little bit of a lower risk of breast cancer. But once those women become postmenopausal, being overweight increases your risk for breast cancer. And that's likely because estrogen lives in fat cells. We store estrogen in fat cells. So if you are overweight, you have a higher circulating estrogen level, which can put you at higher risk for breast cancer. So going back to diet, trying to stay at a healthy body weight is very important. And then the other dietary factor is alcohol. We do know that alcohol consumption increases women's risk for breast cancer. 1 drink a day is kind of standard allowable, but beyond that, every drink increases your risk by about 10%. So you really do want to stay at that, moderation again, one drink per day, if that is something you do. And if you can avoid alcohol altogether, of course, that's better for you in the general sense too. So no, there's not a specific diet. There's question about does soy increase your risk, or different things, and there's not any convincing evidence that points towards any food to avoid, et cetera. So generally, low fat, low alcohol is the best way to go.
Go ahead, Kyle.
Go ahead. No, go ahead, Maddie. Go ahead.
I was just going to say that that's such an interesting fact, because I feel like, growing up, especially as a woman, you hear all of these statistics and all these tips, and I had never heard that before about, drinking alcohol and how each drink increases your chance. And so it's such a good thing to know, especially at my age of 25. So thank you for sharing that.
Yeah, so it's kind of, especially for the 20-somethings, it's creating those healthy habits, right? So just being thoughtful about what we put into our body certainly has longstanding impact for us. So.
And I'm sorry, I wanted to weigh in and just point anybody who's tuning in to our ASPA Talks podcast. This past Monday, we had an episode with a registered dietitian who's a board certified specialist in oncology nutrition, and she and one of her colleagues who's a pharmacist talked specifically about a program offered through Foreign Service Benefit Plan called Cuisine. And it's an online resource tool for people who are going through cancer treatment, and it is support for nutrition, and it is meant to be a guide to them and serve as resources for them, as well as for a caretaker whom they can designate to have access. So that is available to FSBP members who are receiving an oncology drug through the Accredo Pharmacy. That's our specialty pharmacy. So please go back and listen to that, or check our website for more information about that program.
That's great.
All right, let's see if we have another question. I do believe I'd love to hear more about someone has said, how do I best support a friend or family member diagnosed with breast cancer?
So that's a great general topic. Obviously you hear someone that you know or love has been diagnosed with breast cancer, and we want to help. I think there's some general pointers there. I think human nature these days especially is to turn to the internet. So one of the most important things that we can kind of guide people on is just be careful what sites you're going to. It's easy to get into some sort of group chats or other things that, talk about different treatments or things that did work or things that didn't work. And while certainly talking to other breast cancer patients or breast cancer survivors can be very helpful, you just want to be able to kind of verify where you're getting your information, because you can kind of head down some rabbit holes and start to kind of second guess and get yourself all, So just be careful going and choosing what websites you go to. So standard sites like American Cancer Society, are really what we recommend people stick to versus group chat. So that's one thing on the internet. Secondly, just be a good friend. I think sometimes listening, don't tell stories about your cousin, your mother, your this or that you knew who did that, because sometimes that's not what people really need to hear. I think it's just listen to them, try to let them know that you're there to support them. And then for people who are actually going through treatment, people don't always want to accept help, but just offering, if you can be helpful, can you pick up kids? Can you make a meal? Can you do something just to support them? Because as they're going through treatment, of course, their energy is limited. They need to focus on taking care of themselves. So any way that you can kind of support them, I think is super helpful. But I think my biggest caveats are never try to compare breast cancer cases, to each other, because different types of breast cancer are different. They're treated differently. So it's very hard to say, well, this is what happened in the other person that I knew. This is how they were treated, and why aren't you getting that treatment? Because there are certainly variations in ways that this is approached and treated. So try not to compare apples to apples, and just be careful if you're doing research on the internet. It's a wild world out there, so just make sure you're on verified sites that are really giving you top hospitals, Memorial Sloan, different hospitals around the U.S. for sure, often have sites for patient information as well. So those are good trusted sources where you can get information too.
So, and I just want to jump in and follow up, Melissa, when we're talking about where to get information, and I think we talk about your organization, Pinnacle Care. We oftentimes is like a second opinion service, which is absolutely part of what you do, but
Sure.
you also able to provide expert level information to people about their specific conditions. I wonder if you could talk a little bit more about that, just because we're talking about
Absolutely.
where to get information. I don't want to ignore a readily available source for our members.
Right. Sure. Thanks, Kyle. That's a great leeway into that, to what Pinnacle Care is and what we can offer your members. So I think the general way to think of Pinnacle Care is like is if you have a family member who's a physician. So we are a resource that is there to kind of support you and guide you through this process. So God forbid you are diagnosed with breast cancer. What do you do? That's a moment of panic. It's something that we all would certainly be very fearful of. What do you do? Where do you turn? So you've talked to your physicians, they've given you this diagnosis, they've told you what your next steps are going to be. That would be a perfect time to reach out to Pinnacle Care. In that scenario, we can kind of have that discussion with you as what testing has been done, what are the next steps that have been presented to you. We can collect your medical records. Our medical directors review your medical records and just kind of say, is this story following the normal course? And this is for folks all over the world. It's not just folks in the US. This is available to people all over the world. That we can do that preliminary medical records review and kind of say, what are the next steps? If you are in a situation where you're interested in perhaps finding a different local provider team, that's something that our research department is able to do, to look at who are the oncologists available in your area. If you're happy with your local team, then we can also look at who are the top national experts, so we can offer that second opinion. So just to be sure, are you receiving, the right treatment for the right diagnosis? We have a very strong second opinion program that Kyle mentioned. And what does that mean? It does not mean that you don't trust your local providers. It does not mean that you're, looking to go somewhere else or be treated at a different hospital. It is just simply a second set of expert eyes looking at your case. And I have seen, when we offer these second opinions, some pretty remarkable outcomes from them, ranging from very dramatic changes to a change in diagnosis. That expert looks at the pathology and says, this just doesn't look, this isn't looking right. They do a review at their, within their organization and say, this is actually a little bit of a variation in this diagnosis, which can certainly impact the treatment that's offered as well. Or they can look at the case and say, yeah, this all makes sense up until now, but we should also do this additional testing or this additional imaging. There's something else that we should be looking for. So I think it's just a really valuable overview, second eyes as to the treatment that has been recommended or what you're receiving. We can also help with very basic things like when you go to that first doctor's appointment or a follow-up appointment, what are the questions that you should be asking? I think sometimes, especially with a new diagnosis, people are so overwhelmed and they're just not even sure, what they should be asking about. So we can just help with those very basics like that as well. So obviously our service is, I think, valuable, has value anytime throughout somebody's journey. Again, we want to be there to support you, to make sure that you are getting to the right people, getting the right treatment for the right diagnosis. Also, as Kyle, I think you were alluding to, if there are certain, there are scenarios where somebody might be interested in a certain kind of treatment or a certain modality, or maybe a new drug, or something that's being something new and investigated. We have a research department that's also able to provide really great research on new and upcoming treatments, or something that's a little bit out of the ordinary too. So we have a real array of services and support that's available to you too.
Thank you, and I think that's important. This is a partnership we've had for, I think, over 5 years now, between AFSPA and Pinnacle Care, and we're proud of it. We're proud that we can offer this to our members. It's not something that we can do internally. We can't direct care, as it's called, but we can. Pinnacle Care can tell you this person's the expert in your type of cancer. They're offering within your region, within the country, et cetera. So, when someone's facing a cancer diagnosis or another serious diagnosis, this is a fantastic service. So, go back and Melissa went into some more detail even in our podcast. So go back and check that out. But Melissa, thank you for that overview, because I think this is what you all offer is fantastic. And I want to encourage our members to take advantage of it.
Right. And again, just to make it clear too for your members, we are an advisory service, so we are not recommending your care or providing your care. We're not prescribing. We are just, again, simply as kind of another set of eyes, overlooking all of what has been done, what has been recommended, and making sure it's, within standard treatment, and just making sure everything's on course and going according to plan.
Excellent. If it's not clear, Melissa and I have both been through extensive compliance training to make sure we're very clear about what we do and what we
Right.
don't do. So thank you.
Sure.
All right. Thank you for all of that information. I believe we have another question waiting for it to come through. All right. Someone has asked, what sort of symptoms are earlier indicators that there might be an issue?
Sure, great question. Aside from the routine screening mammograms, we also do encourage women to do regular self breast exams. So we know our bodies best, right? So sometimes you could feel something that just feels different. Sometimes it's, the very clear classic lump that just seems to have showed up. Sometimes it's just an area that just feels more tender or more firm. You can see sometimes changes to the skin itself, where it may become red. There's a descriptor of orange peel like skin, where the skin looks almost like very fine dimply. And then also another sign or symptom that sometimes women experience is either bleeding or leakage from the nipple. That can be many, many different things. It is not always, certainly just breast cancer, but certainly that's something that needs to be considered too. So those are probably some of the more common signs or symptoms that women report. But having said that, many breast cancers are diagnosed on that screening mammogram with absolutely no signs or symptoms and nothing that is palpable, no tumor, nothing that you can feel. So please don't think, oh, well, nothing feels different or looks different, I don't need to worry about that. Again, that's the value of that mammogram, because it's able to pick up very small changes in the breast that are not, that you wouldn't be aware of otherwise. So what we do know is that earlier diagnosis leads to much better treatment outcomes. So again, back to the screening mammograms, if we can find this sooner, before there is actually a tumor that's grown larger that now you can feel, or some other change in the breast, we can really do much better for you in that sense. So screening mammograms, but breast self-exam is also really important too. Great question.
And I will just, reiterate that these screening mammograms are covered at 100%, and diagnostic covered at the 90% when you go in network. What I will also say is that breast cancer is our number 2 leading diagnosis when it comes to cancer. Skin cancer was actually number 1 in the first half of this year, but breast cancer was number 1 last year. It was number 1 in 2020, and it's number 2 this year. So please keep that in mind, especially with what Melissa said. Catching it earlier, it can yield much better outcomes. So please make sure you're taking that opportunity to do those annual screenings for breast cancer. Also, depending on who you are and your age, cervical cancer, colorectal cancer, prostate cancer, et cetera, get those screenings. So I think, Maddie, do we have any other questions that have come in? I know we're approaching the end of our time.
We do have a couple of more questions, but I know one specifically was asking about, are there any wellness incentives that AFSPA offers for screenings like that? If you wanted to talk a little bit more about that.
Yeah, no, that's a really good question. And I got that question several times today, actually, meeting with members in person. So yes, there are actually incentives for some preventive screenings. First of all, just completing a health risk assessment gets you $75. Completing your annual physical with a biometric screening, part of, again, good preventive services, gets you $100. These incentives are available to anybody covered by the plan who's age 18 and older. Also, when we're talking about cancer, cervical cancer yields another $25. Your flu shot gives $25. And I know we made some changes, and so I'm going to I'm going to my resource for 2023, because we're making making some changes for 2023. And so I will also mention that, give me just 1 second, because I want to make sure I get this right. Because like I said, we made some changes for next year, but yeah, so cervical cancer, your breast cancer screening preventive, $25, cervical cancer, $25. And then there's also opportunities to do things like colorectal screening, $25, but also tracking physical activity, taking part in coaching programs and so forth. So there's a lot of opportunities in there just for doing what you should be doing each year. And that $400 again is a maximum per person that's available every year. And it does roll over. If you don't use it all, it does roll over to the next year as long as you remain enrolled in the plan.
That's good to know. Good information.
All right. Well,
all right.
Does that bring us to the end of our time then, Maddie?
Yeah, I think so. It's 11:30 on the dot.
Right.
If you have any further questions, you can ask us on any of our social media. We have Facebook, YouTube, LinkedIn, Instagram, and we will do our best to help you and guide you as much as we can.
And I want to say thank you again, Melissa, for joining us today and for joining us earlier this month for the podcast.
Yes.
Sure. Thank you for the opportunity to talk with you all. It's been great. And please, for your members, please reach out to Pinnacle Care. We are here to guide you through your health journey. So we are here to help. Thank you.
Thank you. And anyone interested in taking advantage of Pinnacle Care, you can find information on how to contact our clinical team who can do the live transfer to Pinnacle Care in plan information. I do want to flag one thing before we go. Next month, the last Thursday of the month is Thanksgiving. And as much as I know you all love these events, you may want to spend some time with other people that day. So we are moving AFSPA Live to Thursday, November 17th at 11 a.m. Eastern time. So still the same time, same way to reach us, but we will be on and we'll be talking about open season. So look for some podcasts coming out about open season, look for some emails. You can go to aspa.org/open season right now for a preview, but that will be our focus next month. And also just looking ahead to December, we also will be moving that up to December 15th, also at 11 a.m. Eastern. So a week earlier for the next 2 months. But in the meantime, thank you, Maddie. Thank you, Melissa, and thank you everybody who tuned in and all of our friends who are in the background making this possible. And we'll see you all again next month.
Thanks, guys.
Thanks for watching our broadcast. Join us again the last Thursday of every month at 11 a.m. Eastern. Also, don't forget to look for AFSPA Cares on all of our social media channels: YouTube, Instagram, Facebook, and LinkedIn.